Then the second part of the patient medication interview, that is the information sources, from where we can get the information regarding the patient. That is, one is the patient name and its date of birth uh, is important. Then family history is there. If the any family member, older family member, is suffering from the diabetes or hypertension or any other type of the genetic diseases, that also be covered. If the family patient's family have any type of genetic disorder is there, the doctor can be easily identify early identification of the diseases and can give the treatment, so that this type of diseases can be delayed for the 10 years, 15 years, so that will be increase the longevity of the patients is there. That is very important of the patient's family history. Then medication vials or bubble packs, which type of medication is taken in terms of vials or bubble packs, which is there. Then what is the medication list, how many medication has been taken by the patient, 1 2 3 4 5 6. If the medication increased, there is a chances of increase of drug interactions. If the 5 drugs are taken, there is a chance of 70% of chances of drug interaction. If the 7 or more than 7 medication is taken, so there is chances of more than 90% of drug interactions. That was already studied in the previous chapter, drug interactions. Then community pharmacy, which type of pharmacy or medical shop you have taken the medicine, that is known as a community pharmacy. Then DPIN, DPIN means drug programs information network, means which network you are using. If your family, friends or any type of the online sources has been used for the information of drugs, that is known as DPIN, drug programs information networks, because nowadays all information of the drugs has been available onto the internet or various different medical websites. Then question 2 asked to the patient for the medication history. One, which community pharmacy do you use? Which community pharmacy means nearby or corporate or multi specialty hospital is there, which type of the pharmacy or medical shop you are taken the medicine. Then any allergies to medication and what was the reaction? Any allergies are there to the different types of medicines? So different type of allergies are there. Allergies are hypersensitivity, type 1, type 2, type 3, type 4 are there. Some allergies are the very slow, means after long time, after 24 hours they can show their allergy condition, or another type of the medication which can show their allergy condition very fast or immediate. So and very fast and immediate may also cause the problematic. So many problems can be shown by the allergy, that is shows anaphylactic shock is there, delayed hypersensitivity, neutropenia, rashes, redness, itchingness, sneezing, serum sickness. So many dangerous type of reaction can be produced by the allergenic conditions. Allergic condition due to the parenteral medicine, they are very severe against your tablet form of medication. That should be known by the patient also. Doctor already know, but patient also should know this type of activities or reactions. Which medications are you currently taking? Which medication has been started during this period or currently is there? Then the what is the name of that medication as we are that patient has been currently taken? And then what is the dosage form? It tablet, capsule, solid, semi-solid, liquid, oral, or parenteral type of medication or vaccination type of medication is there. So that also be known by the patient. Then the amount, specifically dose also important, because dose is calculated depend on the weight of the patient. If his weight is really large, the obese patient is there, the dose may be sometimes increased, so that also be known. If a low amount of dose is there, the patient does not have any significant effect of this medicine to the patient. Then the amount, specifically the dose, that is always studied. How are they taking, by which route, that is oral route or parenteral route, that also important. And how many times a day, patient has been taken the your medication, one time, two time or three times is there, that is also important. Then for what reason the patient has been taken the different types of medicine, so that for which diseases the patient has been taken the medicine, that is also known by the patient. Then what prescription medication are you taking on the regular basis or as a needed basis? Regular basis means you are taken the 1 month, 2 month, after the interval of 6 month or yearly basis is regular. He know the patient knows the medication this regularly type of the medicine has been taken, that is known as the regular. Or needy only if the patient become the severe about any disease, then only he taken the medicine, that is the any needs basis. What over the counter medication are you taking on a regular or a needed basis? Over the counter medicine means self medication, how many times you have taken, that also important. Then what herbal or natural medicines are you taking on a regular or herbal or natural remedies? So many people said that this type of herbal or natural medicine does not have the side effects, but they may also produce the drug interaction. So this type of medicine also you should take, but you should ask to the first doctor that I should take the medicine or not. Then what vitamins or other supplement are you taking? Nowadays, due to the COVID-19, so many people are taking the vitamin supplement like vitamin C and vitamin D3. So that also be known by the doctor that with during the patient medication history. So which type of medicine you are or vitamins is being taken by the patient, or other supplements like you are also due to the COVID-19 immunity boosters has been so many people are taking Chyawanprash or Giloy tablets are being taken. So that also be given information to the doctor about this type of medicine, that is vitamins or other supplement is taken by the patient. Then have you recently started any new medicine? If the new medicine is started or not, that also be asked by the doctor, and the answer should be given to the doctor by the patient. Then did the doctor change the dose or stop any type of medication recently? So any type of medicine has been stopped or changed, modified, is that schedule known by the patient. Did you change the dose or stopped any your medication recently? Dose has been changed or not, or stopped, that also be given the information by the patient to the doctor. Then are any of the medication causing side effect? So side effect is the most important part during the medication interview. So that medication, if there is any type of side effect, so that patient should be asked to the patient. So if side effect is there, so patient doctor can give the medication so that side effect can be covered. Then have you changed the dose or stopped any medication because of unwanted effect? So that also be important. If the patient has been formed any unwanted effect, the medication has been stopped by the doctors. So that also be known, asked during the patient medication history interview. Then do you sometimes stop taking medication whenever you feel better? So many patients are there, if they feel better they automatically stop the medication, but they does not complete the course. So that should not happen. If you feel the feel better, so, but the patient should continue the perfect dose or regimen, or full course should be completed by the patient. Then do you stop taking medicine if the meal for worse? So that also be the point is there. If the patient is taking the medicine and he feel the very worse or very damaging condition, so then patient should stop the medicine. So this all type of question is are asked under the medical patient interview. 10 steps to take an accurate inpatient medical history. Inpatient means the patient which is admitted to the hospital, that is not inpatient. Step one into which type of activity should be performed by the doctor or pharmacist. Introduce yourself to the patient and ask the permission to discuss their home medications. First introduce that you are a doctor or which type of doctor is there, and the patient can be easily give the information to the your doctor. Then check each patient name and date of birth. Checking of the patient's name, that is patient name is correct or not, and its date of birth. Then ask whether they came to the hospital from their home or a facility, if you are uncertain. Home means directly himself, or facility means ambulance is there, or wheelchair, which type of the is there, that is how he came to the doctor, that should be hospital, that should be asked. Then ask whether they manage their own medication or if someone helps them. Management, they are taking their medicine, the tablet is there or this is there, so himself is taken or not. So this type of the activity is given by the produced by the patients. So that is very important in terms of the patient medication history. Then ask whether ask about the time, name, strength, dose, route and frequency of their medication. So that is very important in terms of that activities, the name of the drug, strength of the dose and the route and frequency of the medication, very important in terms of the inpatient medical history. Then ask about the OTC product, if any OTC product is taken by the patient or recently taken or previously taken, so that also be known by the doctors. Then asked about the inhalers, injectables, creams, ointments, eye drops, ear drops, nasal sprays, patches and many medication sample. Means any patient is taken this type of the drugs or any type of the formulation is taken. If any patient has a running nose, so the patient himself onto the OTC product, he has been taken the inhalers continuously, or this or he has the eye problem, himself is taken the activity or himself taken the formulation of eye drops, herbal eye drops he has been taken, so that should be known by the doctor. Then ask which pharmacy or pharmacies they use and inquire about the allergies. So which type of the allergies the patient has, any type of food allergy or any type of drug allergy is there, so that should be asked by the doctor to the patient. Thank them and ask whether they have any questions. The doctor or pharmacist should thank to the patient, and he can ask the any type of the actions or any type of the questions have the asked by the patient to the doctor about regarding the diseases or regarding the any type of the medicine, means how many he has to take the medicine, or how much after how many days he can be discharged from the hospital, or how much expenses can be recurred during the this type of the whole medicine or whole therapy. So this type of the question should be asked by the patient to the doctor if he ready to give the answer about that. Then step 10, evaluate the medication history obtained against at least one additional source. Evaluate means you should verify this type of the activity or this type of the medication history. So verify generally if the patient is there. So verification is we can be taken place from the patient's relative, from the parents of the patients or any close friend of the patient. They can evaluate this type of the information given by the patient, and they can verify, and they give the assurance about the 100% accuracy of the this type of medicine. So this is the end of the second part, B part of the patient medical history.